So that means it's a huge number than 9. So for simply 9 you have to remember that P. So C19 clopidogrel, a big name. So C19 clopidogrel, and clopidogrel, P is coming, I is coming, right? So PPI. So that is proton pump inhibitors. It is also very important. Why it is important? Because it has lot of applications. So, and then finally CYP2E1. 2E1 alcohol and paracetamol. So 2E1, you remember, like the drugs related to the liver. So paracetamol, we all know that excess in quantity leads to hepatotoxicity, and also alcohol obviously affects. So 2E1 metabolizes alcohol and paracetamol. So these are the important drugs we must know under each enzyme. We'll see about enzyme inducers and inhibitors. So what is the concept is, say enzyme inducers. Don't think inducers will increase the drug concentration, because see, it is enzyme inducers are substances that induces the enzymes. So for example, a drug is being metabolized by an enzyme to its inactive form, ultimately it is eliminated. So when the enzyme is induced or activated, what will happen? The elimination will be more. So if the drug elimination is more, the plasma concentration will decrease. So that will lead to drug failure. So if it is induced more, so enzyme induction leads to drug failure, because it is inducing the enzyme that is metabolizing the drug. And on the other side, enzyme inhibitor. So enzyme inhibitor are substances that inhibits the enzyme. So when the enzyme that metabolizes the drug is inhibited, that means the elimination of the drug is inhibited. So the plasma concentration will increase. So in the presence of enzyme inhibitors, the drug toxicity will be there. So it's very important to know the examples of enzyme inducers and enzyme inhibitors, because the next application is fully based on this. So you can remember, like I have created a mnemonic for enzyme inducers. You can remember like GPS cell phone, GPS in the cell phone. Seeing that they are going to the bar, I can remember just for the mnemonic. So GPS cell phone bar. So G refers to griseofilament, P phenytoin, S smoking. The PAH, that is aromatic hydrocarbons which is present in the smoking, will cause induction of the enzymes. C carbamazepine, P phenobarbital, B benzopyrene, A is chronic alcoholism. See, because acute alcoholism inhibits the enzyme. Chronic, so bar must be chronic alcohol, like that you can remember. Chronic alcohol, and R is rifampicin. So it's very important. So GPS cell phone bar. Okay, griseofilament, phenytoin, smoking. So you can remember most of the anti-epileptic drugs are enzyme inducers. For example, phenytoin, carbamazepine, phenobarbital, like that. Except valproate, which will come under enzyme inhibitor. So for enzyme inhibitors, you can remember the mnemonic. Vitamin K cannot cause enzyme inhibition because she is a quine. Vitamin K inhibit panel, like that you can remember. Or vitamin K cannot cause enzyme inhibition, you can remember. So vitamin K you can remember valproate, K ketoconazole, C cimetidine, another C ciprofloxacin. Enzyme for E you can remember erythromycin. Inhibition you can remember isoniazid. And quinidine, and quine alcohol kudikranga and grapefruits la kudikranga appadina you can remember. So acute alcoholism and grapefruit juice. So these are enzyme inducers and inhibitors. Most of the anti-epileptics will be enzyme inducers, and most of the antimicrobial will be enzyme inhibitors. See, ketoconazole, ciprofloxacin, erythromycin, so like that. So except griseofilament, it's an antifungal which is an enzyme inducer. So you can broadly remember, like most of the anti-epileptics comes here and most of the antimicrobials goes there. Exception you remember. Otherwise mnemonic GPS cell phone bar. Here vitamin K cannot cause enzyme inhibition. Additionally you remember quine. So So that's it. So rifampicin, isoniazid, they are anti-tuberculous drugs. Rifampicin is a very strong enzyme inducer and isoniazid is an inhibitor. So I hope it's clear. Now it's application based for enzyme inducers and inhibitors. So we have learnt the enzyme inducers and inhibitors example. So for example, it may be asked in short notes or reasoning questions. So for example, first this side induces effect, that side inhibitors effect I have written. So for example, a female is on OC pills, so oral contraceptive pills for contraception. So in that patient, so for example, if the female has got TB and we are subscribing, next we'll see about enzyme inducers and inhibitors application. It's not only important for exams, it's important for MCQs and also for as a clinician it's very important to know, because for example a female is on OC pills and she got TB, and if we are prescribing rifampicin, it's obviously in first line anti-tubercular drug. So if we prescribe, we have seen just now that rifampicin is an enzyme inducer. It's an enzyme inducer inhibitor. So enzyme inducer, that mnemonic we have seen, right? So it is an enzyme inducer. So OC pills are metabolized by CYP3A4. So as we know that 3A4 only inhibits, metabolizes almost 50% of the drug. So estrogen is also, estrogen in the OC pills is also metabolized by the CYP3A4. But that is being induced by the rifampicin. So when this enzyme is induced, that means it is metabolizing the OC pills more. So when the metabolism of the OC pills has increased, that means the elimination is getting increased. That means it leads to drug failure. So OC pill failure is occurring when rifampicin is prescribed. So we should know this, right? For prescribing drugs. So in OC, the female taking OC pills, we shouldn't prescribe rifampicin. Likewise, it's another important thing, 2C19. We have seen 2C, C19, huge, clopidogrel, and PPI, proton pump inhibitors. Both are metabolized by 2C19. So a patient is on clopidogrel is an antiplatelet drug. So it is given in MA patients. So it's a very important drug, right? So, and if suppose the patient gets ulcer, gastric, peptic ulcer, we shouldn't prescribe PPI, because PPI is what it will do. So both are being metabolized by the same enzyme. So it will competitively inhibit the enzyme. It will induce, because that is also being metabolized, right? So it will induce the enzyme. So what will happen? So clopidogrel elimination will increase. So that leads to failure of clopidogrel, which is very crucial, right? It's an antiplatelet given in MA patient. So we shouldn't prescribe omeprazole in them, because omeprazole is an enzyme inducer. PPI, proton pump inhibitors are enzyme inducers, and it leads to increased elimination of clopidogrel. That leads to failure of the drug. So the safest PPI we can prescribe is rabeprazole or pantoprazole, but omeprazole should never be prescribed along with clopidogrel. And another example is 2D6. It's not that important, but 2D6 we have seen in antidepressants and tamoxifen. Tamoxifen is given for breast cancer. So that and antidepressants should not be given together, because that antidepressants will induce this enzyme. So then tamoxifen effect will be gone. So for breast cancer, and antidepressants should not be given. Tamoxifen should not be given in case of patients who are taking antidepressants. Next, coming to enzyme inhibitors. So the really important drug is CAT drugs. See, CAT drugs are cisapride, astemizole, terfenadine. So these three drugs are known as CAT drugs. So that is metabolized by CYP3A4. So what happens? So these drugs, the patients who are taking under these drugs, and we prescribe erythromycin and if ketoconazole or erythromycin if you are prescribing for as an antifungal, antimicrobial. So we have seen just now that erythromycin and ketoconazole, most of the antimicrobials are enzyme inhibitors. So what it will do, the metabolism of these CAT drugs will be inhibited by this erythromycin. So that leads to toxicity of the drug. enzyme inhibitors na toxicity, obviously, because metabolism is decreased, inhibited, so toxicity will increase, and the toxicity of the CAT drugs will leads to QT prolongation in the heart that leads to arrhythmias such as torsalis depointis. So CAT drugs are cute, like that you can remember. CAT leads to QT prolongation in case of toxicity. Like the same, theophylline is given for for asthma. It is given to bronchodilate. Okay, so theophylline is given in asthma patient. Suppose an asthma patient is under theophylline and has got fever or some infections. Okay, and if you are prescribing erythromycin and or ketoconazole, what it will do? This will theophylline. We have seen it is in metabolized by CYP1A1, right? 1A1 morning like that. So when theophylline is metabolized by CYP1A1 and we are prescribing erythromycin or ketoconazole, it will lead to inhibition of this enzyme. So theophylline will be increased in concentration because the metabolism is inhibited. So when theophylline concentration increases, that also leads to ventricular arrhythmias and fibrillations. Likewise, erythromycin and clarithromycin can leads to the toxicity of statins. So, but these 4 examples are very important. OCP failure in case of rifampicin, and why clopidogrel and omeprazole cannot be given together, and CAT drugs QT prolongation, theophylline ventricular arrhythmias. So these 4 examples are really important. Another 2 drugs I missed, so that is warfarin and phenytoin. So we have seen 2C9 mirror image P, phenytoin and warfarin are metabolized base 2C9, and also we have seen phenytoin comes under the enzyme inducers. So right, most of the anti-epileptics. So when the patient is on anticoagulant therapy, warfarin, and we prescribe phenytoin, so it is an enzyme inducer. So that means it will induce 2C9 and the warfarin metabolism will be increased, so that it leads to. So when the patient is on anticoagulant therapy, so and is taking warfarin and we prescribe phenytoin, so it will induce the enzyme 2C9, so that the warfarin metabolism will be increased, so it will be eliminated more, so that anticoagulant effect will be reduced, so that we should not prescribe phenytoin in the warfarin patients. And paracetamol and alcohol both are metabolized by CYP2E1. So when the patient is acute alcoholic, so we have seen that acute alcoholism is an enzyme inhibitor, so that's it. So in acute condition, so it will only inhibit, so alcohol will inhibit this enzyme, so no problem. But when he is a chronic alcoholic, so it becomes enzyme inducer. Chronica, if they are consuming alcohol, that means the liver itself starts producing this CYP2E1 enzyme more, so it's an enzyme inducer. So what happens when paracetamol is taken and he is a chronic alcohol, so that this enzyme is being working more, so it is being induced, so that means more toxic compounds from the paracetamol is produced. Already we have seen it produces hepatotoxicity, because if it is metabolized more, okay, so that forms toxic compounds, that is hepatotoxic. So that's why in chronic alcoholic patient we should be cautious of giving paracetamol dose, because it can cause hepatotoxicity. So far we have seen about the phase 1 reactions. Now we'll see about the phase 2 reactions. So phase 1, the CYP enzymes and oxidation reduction. So these all comes under the phase 1 reaction. We have seen about the enzymes, enzyme inducers and inhibitors also. So now we'll move on to phase 2 reactions. So phase 2 reactions, as we have already seen, games, mnemonic, glucuronate transferase conjugation, or glutathione transferase, acetylation, methylation, so like that. So in that, most important are glucuronate conjugation, glutathione conjugation and acetylation. So in detail we'll see about the 3. So now the most common phase 2 reaction is glucuronate conjugation. So glucuronate is a compound which is conjugated to the molecule which has already undergone the phase 1 reaction. First is phase 1, right? So that's why it is phase 1. So that is a catabolic. Now and conjugation is happening. Any molecule, be it acetyl group or a methyl group, based on the molecule that is being added or conjugated, the reaction name varies. So in the glucuronate conjugation, we are adding a molecule of glucuronate. So for adding that molecule, the enzyme that mediates the reaction is UDP glucuronyl transferase, that is uridine diphosphate glucuronyl transferase. So this enzyme is present in the liver. So it is a microsomal enzyme. So that means this enzyme is present in the smooth endoplasmic reticulum. So why it is important? Because Usually, we have seen that phase 2 reactions are mediated by non-microsomal enzymes, that is, the enzymes present elsewhere from the endoplasmic reticulum. But exception already we have seen, right? So, glucuronide conjugation is alone exception because it is a phase 2 reaction, but it is mediated by a microsomal enzyme. So, that enzyme is UDP glucuronide transferase. Why it is important? Because so this enzyme is present in the liver, in the endoplasmic reticulum. So the main two drugs which is metabolized through this way are irinotecan and atazanavir. So irinotecan is an anti-cancer drug and atazanavir is an anti-HIV drug. These two drugs are especially metabolized through this pathway. So what happens? So in certain conditions we have seen in biochemistry, right? So in the Crigler-Najjar syndrome, that is a genetic defect where UDP glucuronide transferase is deficient. So in this condition, Crigler-Najjar syndrome. So in this condition, so these two drugs are contraindicated. If the patient has this condition, these two drugs cannot be given, because if these two drugs are given, so irinotecan is an anti-cancer drug, but after its action over the cancer cells, it is not inhibited because the enzyme is not there. So what will happen? So it leads to the toxicity. It will start attacking our normal bone marrow and leads to bone marrow suppression. And atazanavir, it's metabolized in the liver, but it is, its toxicity will cause hepatic failure. So Stevens-Johnson syndrome it causes. So these both drugs are contraindicated in case of Crigler-Najjar syndrome. It is the application. And the second application is again the OC pills. So OC pills already we have seen in phase 1 reaction. So OC pills and rifampicin should not be given together because rifampicin is an enzyme inducer. So it will cause OC pill failure. That is in phase 1 reaction. Suppose if the OC pills are being metabolized by the phase 1 and it is coming to the phase 2 reaction now. So it is also glucuronide conjugation is happening. Okay. So what happens in the liver? The glucuronide compound is added to that OC pill and it comes to the intestine. It has been observed to the intestine. In the intestine, what happens is we all know that gut bacteria will be present. So those gut bacteria has secretes an enzyme glucuronidase. So that will break that glucuronide compound which has been attached to the OC pill, and it makes that compound again lipid soluble. See, the purpose of phase 2 reaction is to make that compound water soluble so that it is excreted. So what the glucuronidase is doing is that it breaks that glucuronide compound so that it becomes lipid soluble again, so that it crosses the membrane again and it goes to the liver. So this is intrahepatic circulation, so that the OC pills action prolongs. So it comes to the liver, it gets metabolized in the liver, it comes to the intestine, again glucuronide compound is broken and it goes to the liver. So intrahepatic, because of that intrahepatic circulation, the OC pills action is prolonged. But if we prescribe an antibiotic to this patient, what happens? Antibiotics means what? Not only kills the pathogenic bacteria, it will kill the gut bacteria also. So when the antibiotics are given, so it will inhibit the gut bacteria to secrete glucuronidase, so that intrahepatic circulation will not happen. So the OC pills will be excreted. So here also OC pills failure occurs. So along with the OC pills, rifampicin should not be given, and also antibiotics should not be given. So this is the reason. So two applications on OC pills. One is in phase 1 reaction, another one is here. So this is about glucuronide conjugation. Glutathione conjugation. So it's not only single point is important. So it's a minor pathway only. But glutathione is very important for free radical, to prevent the free radical damage. See, every minute in our body free radicals are being generated, but it is not causing toxicity, or it is not damaging the cells because glutathione is present. So for example, if paracetamol is given, so in excess of paracetamol is being metabolized by glutathione conjugation. Like paracetamol is being metabolized by glutathione conjugation. So when in case of paracetamol toxicity, when excess of paracetamol is present, all the glutathione will be with the help of the enzyme glutathione transferase. So all this enzyme will be involved in the metabolism of paracetamol, so that the glutathione reserves in the body, because everything is going and getting attached and it is being metabolized because it is in higher amount, so that the glutathione reserves in the body will decrease. So when it decreases, what happens? The normal free radicals, the toxic adducts which are being produced in the body, they don't get enough glutathione for its Conjugation. So it goes and attacks the liver cells, and even the renal cells. So it causes tissue damage. So next comes the acetylation. So acetylation is also a conjugation reaction where acetyl group is added to the molecule with the help of N-acetyl transferase enzyme. So what happens? So mainly 4 drugs undergoes acetylation. So these are known as shift drugs. Throughout the pharmacology, it is very important. So they are shift drugs. So that is sulfonamides, hydralazine, antihypertensive drug, isoniazid, and propanamide, and also dapsone will come. So these are shift drugs. So what happens? These 4 drugs undergoes acetylation, and another important thing is, so this enzyme N-acetyl transferase, it shows genetic polymorphism. So genetic polymorphism means based upon the genetic composition, the quantity of the drug may change. Quantity of the enzyme may change, or the quality. So that it shows variations, right, in the quantity or quality. That is genetic polymorphism. So based upon that, there are 2 groups of people. So they are fast acetylators and slow acetylators. That means they have more amount of NAT, fast people, and slow acetylators have less amount of NAT enzyme. So usually Americans comes under these categories, and Indians comes under that category. So the application is in the slow acetylators. That means the metabolism is less. So that means toxicity of these drugs can be increased, and these shift drugs, if they are in increased amount, can cause lupus erythematosus. So that's what comes under the category drug induced lupus erythematosus, that is DLE. We will see in the pathology also when we are seeing lupus erythematosus. There is a separate category of drug induced lupus erythematosus by these shift drugs. So this is the application.